puisque la Banque mondiale et le système économique qui a été mis en place empêchent effectivement à la fois à l'État de pouvoir subventionner.
The level of the health system is extremely low. The level of care is very low because the World Bank is preventing the government from funding the infrastructure and funding the rebuilding of the sanitation and health systems.
Aujourd'hui, quand on n'a pas de moyens de santé, vous trouvez des hôpitaux où il n'y a pas de simple mercurochrome pour soigner les gens. Et vous trouvez à l'intérieur des médecins, parce que les médecins sont mal payés, on fait payer à des malades, justement, ceux qui ne peuvent pas payer, alors que c'est l'assistance publique qui devrait le faire.
When people show up at the hospital, there is such a lack of funding that there is simple no medicine. Doctors, because they are being paid very, very poorly, are asking people to pay them, people who don't have anything to pay with. These costs are supposed to be covered by social benefits provided by the government.
Sur le plan éducatif aussi, on en parle moins, c'est qu'aujourd'hui, nous assistons effectivement dans ce domaine aussi, c'est qu'il y a un manque d'emploi. Puisqu'il n'y a pas d'emploi, les jeunes sont désemparés, les écoles ne répondent plus à la demande justement de la société. C'est un déphasage, c'est parce que tout simplement, tout a été détruit par ce système économique incarné et mis en œuvre justement par la Banque mondiale.
The education system is also failing because there are no jobs afterwards, so young people have given up. Ultimately, there is nothing left. The social structure, economic structure, and educational structure are falling apart. They are failing completely, and the societies are being slowly destroyed because of this lack of funding and infrastructure in the countries, which is caused by the system and policies put in place by the World Bank.
World Bank and IMF policies have had especially harsh effects on African women. Sarah Longwe is from Zambia. She represents the regional organization African Women's Development and Communications Network.
Women are not represented at places where decisions are being made in terms of the resources, how the resources are used. And also they are not part and parcel of how the political parties run themselves, because there are very few women in the political parties' position. And because of not having a voice at a national level as well as at a political level, they will find that the policies, economic and otherwise, have been having adverse effects on women. For instance, when the government started borrowing money from IMF and they accumulated debts, there was no decision made collectively, which included women, to say what we should borrow the money for and how we should use it. And when the debt accumulated, women have been the ones mopping up because of these subsidies have been removed from education, from health, from roads, and these are the very areas which affect women. So women actually have been the ones who have done the subsidies for the economy.
Trade liberalization, extensive privatization, and cuts to health and education spending forced on Zambia by the World Bank have killed tens of thousands of people and made the economy collapse. Zambia holds 10% of the world's copper, which is the country's main income earner. The privatization of copper mines and other enterprises has caused such massive unemployment that only 500,000 Zambians are formally employed out of a population of 11 million. This incredible unemployment has forced women and children into prostitution, which has fueled the AIDS pandemic and created yet more hardship for women. Zambia's life expectancy today is 33 years, the lowest of any country in the world.
People who used to think that they had enough income, they don't have income anymore, and they are totally demoralized, and they've been depression, especially among the men, because to find that they are totally dependent on their wives, and then the wife, what she's doing to keep everybody together is inhuman, to the extent that she has to go early in the morning to the outskirts to buy vegetables and get back, and in between she has to pay the go-betweeners, which would include having sex for the services, or actually the family taking the kids to go in the streets and have sex so they can bring money.
With the kids? Sex with the kids?
The kids have to go out also to get an income. So kids have become stealing, or they become sexually abused if they can be given money, and also that has other effects of drugs, because they're doing things which are really bad and to themselves. So there's a lot of glue sniffing. It's very different from the West because you use drugs which you can, cocaine and things, although there are some who do that, but people have created other form of drugs to forget hunger, to forget the inhuman things they are doing. So they sniff glue, they make if we call it glue, because initially they were sniffing glue, but now they've found a way of creating this, different petroleum, different chemicals, they mix it with paraffin, and then it gets into a strong mixture, and they sniff that, and for a while it takes all the misery away.
The devastating HIV/AIDS pandemic in Zambia has been declared a national emergency by the government. 17% of Zambians are HIV positive, and there are over 700,000 children who are AIDS orphans.
Some also traditional cons have come into play and have even come with even worse things, like for instance, you can be cured for AIDS if you sleep with a virgin, if you sleep with somebody who is 70 years old. So nowadays there are gang rapes of little kids, gang rapes of old women.
World Bank mandated trade liberalization has destroyed the agricultural sector also, thereby causing the expansion of urban slums as well as encouraging the spread of HIV/AIDS. By allowing cheap crop and food imports into African countries, trade liberalization has displaced local farmers who cannot compete. Many such men are forced to move to urban slums for work, where they get infected with HIV due to unprotected sex, and then spread the disease to their wives in their home village. In Kenya's capital, Nairobi, about 60% of the population lives in slums.
Caroline Adeyambo is a resident of Madare, one of Nairobi's oldest slums, where she works as a volunteer with the Madare Mothers Development Center. Caroline is a home-based caregiver who takes care of HIV/AIDS patients.
We as volunteers, we are the ones overburdened with work. The health caregivers are doing nothing at all because they wait for their salary at the end of the month. Whether there is a sick person there, they don't care. It is upon us free caregivers to go and take care of the sick person in the hospital as well as back at home. I give care to the bedridden patients who are living positively or without AIDS or with AIDS. As volunteers, we take them to the hospitals. We look for the relatives if they are near. We dedicate the work to the relatives so that we don't get overburdened. But it comes to a time when we have to go back to our pockets, because when you go to visit a patient, sometimes you find there's nothing, completely nothing in the house. So you have to go back to your pocket, produce some little cash to help the patient. On the other hand, you are not employed. You also at your side, you have a need. So it becomes difficult there. And otherwise, we are happy because we are happy to see our fellow friends improve and they are back to life again.
Kenya has only one national referral hospital, the Kenyatta National Hospital, in a country of over 31 million people. The combined effect of the AIDS epidemic and tuberculosis on Kenya has been catastrophic, given the destruction of the health system by World Bank-sanctioned cutbacks. More than half of Kenya's hospital beds are occupied by patients with HIV/AIDS related infections, and life expectancy in the country has been reduced to 48 years.
Kenya was the first country in Africa to come under a World Bank structural adjustment program in 1980. After 27 years of adjustment, more than half of the population lives in poverty, and Kenya is 148 out of 177 countries on the United Nations Development Programme's Human Development Index, which measures a nation's development in terms of life expectancy, education, and standard of living. Most Kenyans consume less food calories today than they did 30 years ago. Under World Bank